a laboratory educator. So a little bit about myself. I've been in this position for just about a year. It'll be a year next month. Before that, I was a tech in the blood bank and a tech in hematology. So I'm very familiar with all the content that we're going over today. So we're going to talk all about blood bank Typenex labeling and everything around it. So let's get started. I know you guys kind of saw a little bit at the end there. So our objectives today, we're going to go over when a patient requires a typing screen, how to label the Typenex band, all things around confirmatory ABRHs, secondary labels, acceptable labels for the blood bank tests. When a patient needs to be completely rebanded, we'll go over the reasons why. Where to send blood bank samples, and I have a few examples from epic screenshots of what typing screens look like and cross-matching units look like, which is where you guys were coming in. And then we are going to touch briefly on TAG, and then we'll go over questions. So I have to go through this pretty quickly. We have about a 15-minute presentation, so I just ask that you save the questions for the end, if that's okay. All right. Okay, so when does a patient need a typing screen? So any potential recipient for a blood transfusion, they have to have a typing screen done, and that will require them to use a Typenex band for the initial typing screen. So these are the bands. This is what we use for our positive patient identification here at Providence. And these are the new ones. Now these ones are red. You guys will see the yellow ones. I just brought the red ones because they sent us the wrong color, and I thought it would be good for training. But you might see these, so I just wanted to show you guys what the red ones look like anyway. One noticeable difference on these new ones is that they now have a little cover shield on them. So after you fill out the band here, peel it off, label your tube, and you have the transferred patient information underneath it, you can peel off this label, and it's a little sticky cover shield, and it'll just protect the patient information. Another thing on these bands is they have these 4 little stickers with the smaller barcodes on them, with the Typenex numbers on them. These stay on the band with the patient. These ones with the large barcodes, these can actually rip off, and that goes with the tube to the blood bank. Okay? And I brought a bunch of these, so you guys feel free to take them if you want to. You can practice writing on them, keep them for reference, whatever you want. I brought a ton, so feel free. Okay, so let's talk about how to properly label the Typenex band. You first and foremost need to verify your patient. Usually we have the person who's collecting and typing out or writing out the Typenex band to verify with the patient. Of course, you guys can't do that in surgery, so we just ask that you have another member of your team verify the information with you, check for accuracy, check for legibility, check for all the required information is there. Have somebody check with you. What you need to do is use a black pen, and you will write the patient's name, has to be last name, comma, first name. Has to be in that order, no ifs, ands, or buts, it has to be that way. You'll need the patient's date of birth, you'll need the date, time of draw, and your initials of you who's drawing the sample. So those are all required information. If any of that is missing or misspelled, or patient's name is written in the wrong order, it will be rejected and it will have to be done again. At that point, you would, once you have completed writing out the band with all the required information, you've had somebody check it, you're verifying against the hospital armband because they should be the same. Then you can draw your pink top tube, you can peel off that label your sample, and then when you guys are ready, you can attach it to the patient. I'm assuming that's towards the end of surgery, whenever you're ready to attach it. And I do have, in those same instructions there, I have printed out here, and you can take these with you, and it gives you instructions on how to attach it to the patient as well. So they're much easier. Have any of you used the new ones yet?
Yeah, you don't have to push as hard on them. The old ones just couldn't clamp them down.
Okay, so let's talk about the confirmatory ABRH sample. So the AABB states that if the blood bank does not have a previous or historical record, and it has to be at this location, no other Providence of Swedish, it has to be here at PRNCE, then we have to have a second or confirmatory blood ABRH sample. So this is needed it has to be a separate collection for one, from the type and screen sample, 2 different pokes. And that is needed, both of those criteria are needed to get type-specific blood to the patient, which is what we want to do as soon as humanly possible. It's the safest for them, and it can potentially get us away from using our universal blood products, which we want to conserve as much as possible. So we ask that if you are required to draw a confirmatory sample, we will call you and tell you this is something that's ordered from the blood bank, so we perform a history check on these patients, and if we have a historical type, we don't order it. We don't call you, we don't tell you that we need it. If we do need it, we will call you and tell you, and we will tell you exactly what sample you need to draw and what kind of labeling you need to use. So specific labeling for the confirmatory ABRH, again, I highlighted there has to be a different collection time. You can use Care Fusion, which I know is not available to the OR, or maybe not in every room. So we will accept from the OR only, we will accept the Epic chart labels. And that's it, you guys are only. Anywhere else in the hospital, we do not accept that. Or you can use the blood bank white label, which are the secondary labels, which the last group was not familiar with these. But they look like this, and they have all the same information required on them as the Typenex band. So you have the patient name, and it tells you how to list it on here, last comma first, date of birth, Typenex number, date, time, draw, initial. So it provides all the same information. So you would fill this out per the Typenex band on the patient or near the patient. But from what I'm hearing, you guys don't have these stocked in here, so this is probably new. Or maybe some of them.
Yeah, it's nice if they have date of birth on here now, because the old band just had ID.
Yeah,
like,
it didn't
a lot
give
of
you
people,
any
a lot of people would
information.
put like, a lot of people would either put like, instead of the birthday, they'd put like the MRI number
Yeah.
or something.
Yeah.
So this is
Pass
good.
it around.
Yeah.
It's a nice little face.
Yeah, absolutely, please do. So those are the acceptable labels for the confirmatory ABRH. And like I said, like we will exhaust all sources first. So because you can use Care Fusion on that, if they did have a previous collection, we will go and look for the CBC as long as it was within 24 hours. And if it was labeled Care Fusion, we'll use it for the confirmatory ABRH. Like we'll use whatever we can, so we don't have to bother you guys to draw the sample. But it is required to get that patient switched over to type-specific blood. So. Okay, so let's talk about the secondary blood bank labels then. So I kind of went over it a little bit before, but I had some illustrations here. So the top one is what it looks like completely filled out. And these are used for actually many things. These can be used for repeat type and screens. So that's inpatients that have been here longer than 3 days. The type and screen sample itself expires after 3 days, so they have to be redrawn. But they don't necessarily need a brand new Typenex label made up. They can, as long as it's legible, you can use the same Typenex information and fill it out on the secondary blood bank label. That's one instance. Another thing we would use them for is if we are requiring a redraw for a patient, but the Typenex band is perfectly acceptable, but let's say the specimen integrity is questioned. Maybe it's extremely hemolyzed and we can't use it for testing, or if there's not enough sample and we need additional blood. So those would be times where we would say, hey, we need a redraw. Can you draw another pink top tube? We don't need you to reband the patient, just fill out a secondary blood bank label. These can also be used for the confirmatory ABRH, like I mentioned before, but definitely the thing I wanted to highlight here is that they are, when you fill these out, you are required to either handwrite the Typenex ID or use one of these stickers that are left on the band for the patient. These just peel off, and you can use those and just slap them on there. So either way, has to be on there. Okay, so that was a ton of information. So let's go over acceptable labels for these tests in the blood bank again. So the type and screen, used for potential recipients of blood products for everyone, and that starts out with the Typenex band. So Typenex band equals type and screen. That's what you do initially. For repeat type and screens, for redraws due to hemolysis, insufficient quantity, things like that, we would suggest it, or we would tell you to use a secondary blood bank label. It's just as good as the Typenex, but the Typenex needs to be first. For the confirmatory age or age, can't stress it enough, separate collection, 2 hooks. Needed in addition to the typing screen to receive type-specific blood, and there's our 3 choices here. You can use CareFusion, you in the OR, you can use the Epic chart labels, or the secondary blood bank label.
So we need to get a stock of those secondary blood labels.
Yeah, and we have a ton. We can absolutely send them up here.
I think we would at least need a roll for each core.
Yeah, this is just a small section that I just peeled off. They're in pretty big rolls. So
it's nice that they make it very clear the required information.
Yeah. So it really doesn't leave it up for any kind of interpretation. It's listed right there for you what you need to put.
Because in the past, I think that's how we've lost a lot of samples.
Oh, really?
Yeah.
Okay, so I want to go over with you guys too when the blood bank would be requesting a brand new Typenex band to be used. So there's 4 reasons on here. These might not all apply to you in the OR, but I at least want to make you familiar with things that come up and why we would request a new Typenex band to be done. First and foremost is if they are rejected, if the required information on the Typenex band is either missing, it's not written in the right order. Let's say the last name, you guys wrote the first name, last name, but it has to be last comma first. If the patient name is written in the wrong order, illegible handwriting, that's something too. I need to emphasize that when you guys are filling out these bands, use the most legible handwriting you can because somebody else is reading that. We have to make sure every letter is what it is and it matches 100%, same with the date of birth. So when you're writing the numbers, letters, the names be very, very clear. A big thing that happens when we need to is with our unknown patients. So unknown patients have to be treated the exact same way as any other patient. They're listed as unknown in Epic, so the Typenex band that you write needs to reflect that. The generic name, generic date of birth, it has to be written exactly the same as any other patient. However, when they rename them in Epic, now the Typenex band does not match what's in the computer. Now it doesn't match their hospital armband. So we would request that you cut that one, make a new one. That means a new type and screen sample. Everything has to be tested again. If there was cross-matched units, we return them in our system and then re-cross-match them when the new type and screen is complete, and then everything matches for that patient. So, us in the blood bank stress to admitting to not update that information until everything is calmed down with the patient. But we all know, I'm sure some of you have been in situations where that has happened in the middle of surgery. I know in blood bank it's happened to us, it's happened to me, and it is a huge pain. So especially if they're receiving active blood products, it's not a good situation at all. When it starts not matching, we have to stop giving the cross-match blood products. We have to switch back to universal products until we can get a new Typenex band with the correct information, retest the sample again, re-cross-match type-specific units, and then start giving those. So it's a huge pain when that happens. So they are not supposed to update that patient information until everything is calmed down with that patient. Another reason we would request that is if the Typenex band has been removed from the patient's arm. Of course, being in surgery or procedures, that's an exception to this. You guys have to remove them. They're near the patient. So when you guys do that, we have the extenders that you can use, and these ones are a lot different than the old ones. So when you guys have to cut the band, you would request an extender from the blood bank, and then these bands have the 2 little holes in there now, so it just feeds through that and you just connect it right to the patient. So it's much easier than the last ones. However, I still wanted to include that on here because sometimes everywhere else in the hospital when this happens, they can't find the patient's armband, it's just gone. we request that they have to be rebanded, we have to re-cross-match units, do testing all over again, etc. So I just wanted to point that out. However, you guys being in the OR, you're
I guess I want to see how you're applying that extender, and in the past, we've had stock. This happens a lot. This happens a lot. Cutting the armbands off on the operative, they've been placed on the operative arm or the operative side, where suddenly they have to put an art line in, and they don't want a constricted band there, they want it moved. So in the past, we've had the not an extender, but a yellow band that we could slide that into.
Yes.
We're gonna need stock of those.
Yeah.
Girls, they send them up. If
Yeah.
you call, they'll send it with a little instruction sheet too.
Yeah.
It's so sneaky.
Which I have.
This is way better than the old
Yeah.
system.
Which I have here. They're called the R3 bands, but it just slides through those two little holes and then it just clasps into place, similar to the new one. So from what I have heard, of course, I don't ever have to use, I don't attach armbands to patients, but from what I've heard is that these are much, much easier to use than the little slip things. Those were for the old bands. So these are what we get for the new ones. So. And then the very last thing, if the Typenex band for some reason becomes illegible and we can no longer verify the patient information or the Typenex number, we would then have to have the patient rebanded. Now with these having that little cover that slips over the patient information, that should hopefully not be an issue anymore, but I did want to point it out there because it is a reason to have a patient rebanded. Okay, where to send the blood bank samples? So normally everything goes down to the main lab, tube station number 10. Our lab assistants are manning we have 3 tube stations down there. They're manning all 3 of those for the whole hospital. They receive specimens and then distribute them to their respective areas. So we wanted to give this an option for you guys if we're in a trauma or a situation where time is of the essence and we need testing to go very quickly, get units cross-matched quicker. We suggest that you tube the blood bank samples directly to us. We're right by our tube station, so we constantly see it, and that would be the blood bank staff receiving those samples and processing them immediately, which could shave off some time. So our tube station number is 83. I've included there. I included the phone numbers too. I'm sure you guys have them. I just put it in the slides just for an FYI for you. But that would, especially for traumas, that would make it go a lot quicker. If we send 83, yeah. Yeah, that would go a lot quicker for us, so. Get the ball rolling a little faster there. Okay, so here's, and I know some of you walked into this, but here's my examples from Epic, and I have to give you a disclaimer, the laboratory does not use Epic, so I am in no way an expert on what these look like, and our views might be a little different than yours, but these screenshots were provided from our blood bank supervisor to me, so I'm just going to explain kind of what they mean. So the first example here is a patient with a current type and screen and cross-matched units. So the left one, and I guess we're under nursing overview here. So I'm sure you guys are very familiar with that. I'm personally not. Under the summary tab, you can see right in this box here that's highlighted, it's blood products available for transfusion. If that box is there and it gets a number, it says 2 RBCs. That means there's 2 units cross-matched in the blood bank ready for the patient. You can request them, we will issue them and send them up to you. On the right-hand side is the type and screen, and this is under the blood transfusion tab. And then under type and screen, there is the date and time that it was, I'm assuming this is collection. And then you can see the results here, the RH, ABO, and then the antibody screen. And this one was actually positive, so you can see the antibody ID right here under antibody identification. But if something is listed in here under type and screen, that means they have the current type and screen. If it's blank, nothing is there, that means there's no current type and screen. That's what I've been told. So if you guys see nothing in that box, they don't have anything current, or it's not completed testing. And then the next one, we have inpatient with an in-bake type and screen, but no cross-match units. So same thing here on the left, we're under, this is under the blood transfusion. So there's the type and screen listed, and you can see the results, the date and time of collection. On the right-hand side, under the summary, where the notches are on that box, it's empty. That's where the blood transfusions or blood products ready for transfusion would be. It's blank, there's nothing there. There's no units cross-matched for that patient, is what that means. And then our last example is an inpatient without an in-date typing screen, but they have a history of a typing screen and cross-match. So on the left, back under summary, we can see the typing screen is blank, so there's no in-date typing screen done. However, below that, you can see a history of transfusion. So they actually received 2 units. So there was, at one point, a current typing screen, but there's just not one now. So it expires after 3 days, so that's why it would be blank. And then on the right-hand side, again, this is under the summary tab where the little notches are. That's where you would see any products available, and there's nothing there. So there's no products cross-matched, which would make sense because they don't have a current typing screen. Okay, last but not least, TAG, thrombelastography. So Tanya asked me to touch really briefly on this because apparently there was a situation that happened recently where the tubes were sent down, but they weren't sent down with that little bubble wrap pack. But the lab accepted them, so I wanted to touch on that. So these kits are made by us in the lab, and we supply them to you. So if you guys, and I do want to say, if you guys see that you're running low, call the lab, we send it more to you. So they're stocked from us. Inside the kit, inside that bubble wrap bag, you have the specimen baggie with the tubes that you collect. You collect all 3, send all 3. And there's instructions, a little pamphlet in there for instructions on how to collect it and how to send it to us. So if you're using the tube station, you have to send it in that bubble wrap. So it is a coagulation testing. Platelets can get activated. It goes on a really bumpy ride down there, and that bubble wrap is meant to smooth it out, and so there's not a lot of movement. And so it won't falsely activate any clotting factors or platelets, and it won't skew results. So that's what's been validated to do so. If it's not sent in that bubble wrap and it goes through the tube station, they should be rejected. So when that happened, I don't know when that happened, but the samples were accepted by the lab. They should have been rejected if they did not come down in that bubble wrap. Or, I don't know if you guys ever walk stuff down to the lab, but that would be the alternative. If you don't want to send it in the tube station, you have to walk it down to the lab without the bubble wrap. That's it. Any questions?
So for a patient that has an in-date, no typing screen, but has a history of transfusion, so that means we do not have to do typing screen anymore.
If they're gonna get potentially more blood products, then yes. Because the typing screen sample is only good for 3 days, which means any cross-match units are only good for 3 days. So if you have to redo the typing screen, we do the test again, and then they can order units on an in-date sample. Does that make sense?
Yes.
Okay.
And how long can the cross-match, if not transfused but available, how long can it stay?
They are indated for the length of that typing screen sample. So if you have, let's say for example, they drew the sample and it's day 1 out of 3, right? Because it expires after 3 days, and they order blood products but they don't transfuse, we would keep those products for those 3 days for the duration of that sample. Once that sample has expired, the cross-match units are no good, and we would put them back in, like roll them back in our inventory and try to use them for somebody else. So, yeah. Anything else?
And this PowerPoint will be sent to all of us in the network. Will this be available?
Yes.
Okay.
Yeah, so Wendy's videotaping, and then I'm going to send the PowerPoint, so it'll be available. I do have other videos to you. I have plenty of resources for this, so I can provide you guys anything to put on your SharePoint, so there will be a plethora of information about this.
Are people in this room, are you used to seeing this epic view?
No, I haven't.
Yeah, our view is very different than the floor view. I'm not sure, I mean, I would have to really look to see if we have access to that view. I mean, we normally, for the most part, if I think I have a patient who's going to need blood possibly in the room, I'm calling you guys, and I want verbal verification. Is that what most of you are doing? Yes. I'm not sure I can even see that view. So I'm not sure the whole epic portion of the even applicable
Okay,
for us.
yeah,
I mean, we're just,
That's what you
A
see
weird
in
group.
inpatient plan,
Yeah.
for sure, but.
and so are we, because we don't use it. So what we see is much different than what any other nursing sees too, so we don't have the same
completely
position.
different what recovery sees.